Welcome to the Patient Safety and Falls Prevention Lecture. This is one of 7 of the stroke education presentations that the IRU staff provide, and this particular presentation is provided by physiotherapy. My name is Michelle Beaudry, and I am one of the physical therapists that works here on the intensive rehab unit. So the presentation involves patient safety in the hospital, hazards that you might experience at home, and preventing falls. For patient safety in the hospital, we recommend that you keep a clutter-free environment. Be sure there is a clear path to the bathroom. If you feel that there is equipment that is in the way, like a bedside table or a wheelchair, please ask the staff to help you remove those obstacles so you have a clear path to the bathroom. Accurate lighting is very important. Night lights are helpful, and we have some of those in the rooms that can be helpful at night. If you need to get up at night to go to the bathroom, we recommend that you turn the lights on. Please use appropriate footwear when walking. It should be supportive, have a low heel, and fit well. We don't recommend flip-flops or over-the-toe slippers. Shoes are better, or a full slipper is better. Patient beds should be kept at the lowest position with the brakes on. I would recommend that you discuss this with your physiotherapist, and that person can recommend the best position for you and set the bed up. Always choose a sturdy chair with armrests. We used to use chairs with wheels on them for the computers and have now removed them. We would definitely recommend no stools with wheels, no chairs with wheels. Most of the chairs within the rooms are appropriate with the armrests and a sturdy back. The call bell must be kept within reach of the patient at all times. If it is not, please ask the staff to move it closer to you within reach. If you experience lightheadedness, dizziness, or if you feel weak, please let the staff know, as those symptoms are not normal and we need to know to keep you safe. Please keep the frequently used items within reach at all times. Again, ask the staff to move bedside tables and telephones closer to you. Ask the staff to make sure that the call bell is close to you. Please use the transfer techniques that were instructed to you by the nursing physiotherapist or occupational therapist. These are given to you for a reason and should be followed. The number one reason that patients fall on this unit is that they overestimate their abilities. So if at any time when you're doing a transfer or you're reaching for an object and you think to yourself that this might be risky, please listen to your instincts. They are usually correct, and call for help. Get help to reach the object. Don't overestimate your abilities. Always use the equipment or the aids that were given to you, such as wheelchairs or walkers or canes or even braces. They were given to you as a safety precaution, so please use them. Stairs are always a challenge for patients, and we will go over stair training in physiotherapy to teach you how to do the stairs safely. Your family member will also be instructed on how you negotiate the stairs. Handrails are also recommended. If they are not already in place at home, we would absolutely recommend that you put up handrails on your stairs, and usually 2, not 1. So let's talk about safety at home, household hazards, and fall prevention. So what can we do to prevent falls? Well, we know that exercise and walking absolutely helps prevent falls. We know that maintaining a well-balanced diet is very important. You need to control your blood sugars if you are diabetic. We would ask that you see the eye doctor once a year to make sure that the prescriptions that you have are accurate and helpful. We would ask that if you are experiencing dizziness, faintness, lightheadedness, that you please talk to your doctor about those, because those symptoms are not normal and should be investigated. We recommend that you take good care of your feet. Things like bunions, corns, blisters, openings on the feet can be sore and cause limping. And limping can also lead to falls or loss of balance. So please look after your feet. You need to talk to your doctor about any side effects effects that you may have from your medication, because sometimes those contribute to falls. So for example, if you're taking pain medication that causes some sedation side effects, then you would not want to take that before you drive. You wouldn't want to take that before you negotiate a set of stairs. So you may want to time your medication, or even better, time the activities that you're going to do after you take medication so that you don't suffer any of the consequences of those side effects. What can you do to prevent falls? One of the biggest things is that if your physiotherapist or your occupational therapist has suggested that you use a cane or a walker or any brace, please use it. They have done so to help your walking and help you avoid falls, so please use the equipment that is recommended. The other thing we recommend is that you do not progress yourself, especially on weekends or once you go home, to a different gait aid without seeking advice from the occupational therapist or the physiotherapist. So let's talk about hazards that you would find in your house. So in the kitchen, we recommend that you store items that you use all the time very close to where you're working. So in the bottom shelf of the cupboards, above the counter, or on the countertop. Put these items where they're easy to reach. Do not use step stools, step ladders, or chairs to climb up and reach things in cabinets. We've had many patients fall off of these items. Please use a long-handled sponge or mop to wipe up any spills that might occur in the kitchen. Bending over or getting down onto the floor is often difficult for patients, and they lose their balance and fall. Consider using a cordless telephone, and I think by now most people don't have corded phones anymore, so use a cordless phone. And that's one of the things that you need to be very careful with in the hospital as well, because in our hospital rooms, all of the phones are on cords and are quite dangerous. So please be careful of the cords on those telephones. The bathroom is another area that has some slipping or tripping hazards. So we recommend grab bars in the bathroom to get in and out of the bathtub or the shower and around the toilet. We recommend non-slip mats in the tub or in the shower floor to help prevent slipping once your feet are soapy and wet. We recommend a bath chair or a shower bench to use in the shower so that you can sit for periods of time so that you don't get weak or lightheaded. We recommend raised toilet seats so that the toilet isn't low. The average toilet is about 16 inches off the floor, which is very low for most folks to get up off of. So we recommend raising that height with a raised toilet seat. We also recommend Versa frames or arms around the toilet so that you've got somewhere to hang on to balance and help get up and down off the toilet. One of the other things that's very handy is a soap on a rope. So this item was very popular back in the 70s, kind of hard to find now, but you can easily make a soap on a rope if you take a pair of pantyhose and cut them in half so that they're each individual legs. You toss the bar of soap down into the toe of the pantyhose, and then you tie it to the grab bar in the shower or on the grab bar of the bench. And then if you drop the soap, you can easily retrieve it using the pantyhose. So that'll avoid one, dropping the soap and then having to try and reach or bend forward to reach the soap. And we've had people fall off of their shower benches or chairs trying to pick up items that they've dropped. So let's talk about the bedroom, entrance, and the living rooms. In these areas, you want to make sure you have good lighting, and actually you want good lighting throughout your home. Night lights are very handy in bedrooms, hallways, and bathrooms. Never get up in the dark. Make sure that you turn on a light when you're getting up to, let's say, use the washroom in the middle of the night. We know that balance is significantly limited or decreased when you're trying to walk in the dark. So please turn on the lights if you're getting up at night. Rugs are another tripping hazard. We would recommend that you firmly fasten them to the floor. If it's a large area rug, make sure there's a non-skid backing underneath it. You can tack down the corners if you have to. Fringes are another thing that are quite a tripping hazard. And then any smaller mats, like at the front door, at the tub, maybe in front of the kitchen sink, we would recommend that you roll those up, put them away, because those are definitely tripping hazards because they move and they catch their toe on them. Electrical cords, be sure that those are gathered up and tucked away. So you can see in the picture that has electrical cords strewn all over. Christmas time is one of the riskiest ones because we're plugging in lights and different decorations. So please make sure that those are all tucked away, not crossing any of the walking paths in your home. Stairs, again, make sure that you take your time on the stairs. Always use the handrail for support. Be sure that the stairwells are well lit. And the rule of thumb is that your good leg leads up the stairs and your bad leg leads coming down the stairs. So that's kind of the general rule of thumb. Please know that the physiotherapist will go over stair climbing with you, and that rule may change depending on your abilities, but they will go over it with you and your family. And one of the last things to remember is really just clutter in general. Keep your rooms and hallways free of clutter. The best thing to do is to put the furniture, open up the space, put the furniture to the walls, remove objects like coffee tables, end tables, decorative furniture that's not really necessary or serving a purpose. Tuck that stuff into a spare room so that you open up the space so that walkers and wheelchairs can freely move within the space. Be sure there's no clutter like magazines, toys, if there's kids, pet toys, things like that. Try and make sure that the hallways and the walkways are clear of clutter. So there are other possible tripping hazards. Like we said, pets can be, depending on the size of your dog. Jumping or pulling by a dog is dangerous when you're trying to walk them. And then small pets that end up in amongst your feet when you're trying to walk can be a tripping hazard. The other thing to remember is clothing can be a tripping hazard, especially on stairs. So skirts, dresses, and house coats, you can step on them if they're too long while walking or trying to negotiate stairs. So be careful of those two items. Footwear is something that is very important, and we recommend that you avoid loose-fitting slippers that you could that can come off your feet while walking. So for example, flip-flops, or like the purple one in the picture there that don't really have anything around the heel. Those are risky, and we have had patients fall. You want to avoid high heels that have over 1 inch of height. You want to wear walking shoes, and you don't want to wear socks or stockings on bare floors. Those are very slippery, especially on like hardwood or laminate flooring. So we always recommend that you clean up an older pair of shoes, wash the soles, and then wear those in your house so that you've got support on your feet when you're walking in the house. Some of the recommendations we make about footwear also is when you're buying footwear, look for a shoe that sits flat on the floor. Make sure that it doesn't rock side to side, left or right. If it does, put it back on the shelf. That one isn't for you. The other thing to look for is that it's got enough depth at the toe and that it has enough width for your toes. Tight shoes across the bunion or at the toes can cause sores. And especially for our diabetic folks, that can lead to infections and other issues. So be sure there's enough room in the toe box. The other thing to look at is if the heel of the shoe is collapsible, then it doesn't have enough heel support. The heel should be nice and stiff and cup your heel. If it's soft and moldable, it's not the right shoe. Put it back. So some of the extras that we like to talk about are some of the symptoms that you might get when you sit up quickly from the edge of the bed. So when you're getting out of bed, you want to make sure that you sit on the edge of the bed for a few minutes before standing. Your blood pressure takes some time to adjust. If you move too quickly, your blood pressure may not be able to keep up, and this can make you dizzy and cause you to fall. So for example, when you wake in the middle of the night and you realize that you need to go to the washroom, sit up on the edge of the bed and give yourself a minute just sitting there. This will allow your heart to catch up, because when you're laying down, your blood is being pumped on the same gradient, all on the horizontal. When you sit up, now your head is above your feet and your blood has to be pumped uphill. It takes a minute for your heart to adjust to that. So if you give yourself a minute sitting on the edge, that dizziness, that lightheadedness should pass, then you can stand, then you can walk to the bathroom. So just be cautious with that, because sometimes when we wake in the night, we're urgent to get to the bathroom, but you want to give yourself that time so that you don't end up falling down. There are also lifeline and helpline services that allow you to get help simply by pressing a button or a bracelet or medallion. So you'll have a watch that you can hit the button, or you'll have a medallion that you wear around your neck where you just press the button. So then you don't have to worry about trying to use a phone, finding the phone. The attendant will assess the situation, so you'll have a speaker unit in your house where they'll be able to talk to you through that. And then they'll be instructed either to call a family member to come and check on you, a neighbor, whoever you've listed when you sign up for the service. And then if they can't get a hold of you, or they can't get a hold of the neighbor or your first contact, then they will send the ambulance. So these are in place to make sure that people don't end up unwell and then can't get a hold of anybody, and you end up waiting for help to show up at your house just randomly. So we've had clients that have fallen and have been on the floor for several hours waiting for someone to finally come to their house. So this is a couple of services that are listed here will allow you to get help quickly without the use of a telephone. So the references for this talk are the Heart and Stroke Foundation, the Health Sciences North IRU staff, and the physiotherapy staff. And thank you for listening.